Hi everyone, my name is Dr. B.B. Das. I am a gastrointestinal surgeon. I practice robotic surgery to do surgeries of the abdomen. If you see, for last 1 or 2 years, everywhere in India, all the surgeons, whether it is abdominal surgery or whether it is a cardiac surgery, whether it is a thoracic surgery, whether it is a surgery of the neck or of the thyroid or of the breast, everywhere the surgeons are talking about the advantages of robotic surgery. From traditional methods to change to robotic surgery, the patients feel maybe confused, like how good it is, how safe it is, how costly it is, and truly how much it is different from the normal standard surgery. Take for example, a gallbladder stone surgery. When someone comes to me, because I practice robotic surgery, I usually tell, you see, the robotic surgery is very good, you can go ahead and do it. But the same person goes to a doctor who practices only laparoscopic surgery. As a robotic surgeon, I tells them, for a gallstone, do robotic surgery. The same patient goes to a different doctor who practices only laparoscopy, not robotic. He tells, I'll do a nice job with laparoscopic surgery. Take about cancers. The surgeons who practices open and laparoscopic surgery, they tell we do an extremely good job with the current methods. At a lesser price, it is more affordable to the patients. And the surgeons, those who have learned robotic surgery, they tell it is much better, you go ahead with it. Sometimes the patients feel confused whether the robo is doing or the surgeon is doing, whether the cost they can afford or not, and whether any complications related to robotic surgery is there or not. Because for them, it is a newer technology. So they ask their family doctors, they ask other doctors, and they might have a different view. So in this regard, I feel, because I belongs to the other side, as a doctor, as a surgeon, I should speak not like a robotic surgeon, as a surgeon, how good is robotic surgery. If you see, robotic surgery is nothing but more precision. The same surgery, the surgeons do with much more precision because they go closer to the tissue in a smaller cavity, and the hand movement is replicated inside the tummy, and it goes to the exact area wherever the tumor is there, wherever a stone is there, and it does the job even sometimes better than a human being. Like as a surgeon, sometimes if I am stressful, my hand might have tremor. But the robotic instruments, which is controlled by a surgeon, does not have that. So a tremor-free surgery, a surgery with small little holes, a surgery which is done almost like a surgeon's hand, but not making a big cut. You know, when we used to do surgery, a cut is made from gyphy sternum to the pubis, such a big cut. So a smaller incisions, better precision and better cure. There is no doubt achieved with robotic surgery. But at what cost? And is it better than laparoscopy? You see, as of now, the common surgeries, like a simple gallbladder stones, maybe a simple appendix surgery, probably is as good laparoscopically as robotically. But if someone needs more precision, but definitely a robotic surgery is better. But think about a patient who has a gallbladder disease, which is inflamed, infected with multi-organ failure. Definitely, a normal surgeon will decide to cut open it because safety is more important. But if you can do the same thing robotically without cutting open, the patients go home early, they need lesser antibiotic, lesser ICU care. Think about certain parts of the body, like, inaccessible location, like someone doing a prostate cancer surgery, the urologist. To go into that area, even with your hand, even cutting open the abdomen is impossible. Think about a surgery of the lower anal canal, rectum. Even our hands don't go there. We can't do a proper removal of a tumor in that area, even with our good vision with the hand. But the robotic small instruments, they do the exact work of a surgeon down there with small little tips. They do a meticulous job as if your own hand is doing. So they can go to smaller narrow space, inaccessible locations, and do a wonderful job tremor-free, without much blood loss, without affecting the other organs. So certain surgeries, definitely robotic surgery can bring less pain, less stress to the patient, lesser complication, and better cure. So for them, I feel robotic surgery should be practiced by majority of surgeons. One more issue is there, the cost. One more issue is there, training. So I believe as the time goes on, though probably the laparoscopic towers are going to be replaced by the robotic instruments, and this in turn will reduce the cost, and that will make it more affordable for the patients. And coming about the cost, think about staying in the hospital, staying in the ICU for a complicated surgery and spending the same amount of money, and going to an experienced robotic surgeon, whether it is for cancer of the stomach or for the colon rectum, even for endometriosis or for a prostate cancer, to a urologist. What happens? Your surgery is done with small little holes in a more precise way, and you go home early within 2-3 days, maximum 5 days time, which in turns makes the cost much more effective. So boiling down to the point, robotic surgery is no doubt is the future of surgery in almost all disciplines, because it will give more precision, better results, lesser complications. We have to embrace it. Probably over a period of time, the cost is going to be down, so that more and more patients get benefited out of it. And I wish more and more surgeons get trained in robotic surgery, and more institutions should train the surgeons in robotic surgery and keep the robotic instruments so that the patients get maximum benefit. Thank you so much.